Achondroplasia Dwarfism by Edron Hermoso and Riley Lane. What is achondroplasia dwarfism? So the definition of achondroplasia is without cartilage formation. This is the inability of the body to convert cartilage into bone, which is the opposite of ossification, which is the process of converting cartilage into bone. It is the most common form of dwarfism, and it impairs the growth of bones in the limbs and causes abnormal growth in the spine and skull. The clinical and radiologic phenotype have been described for more than 50 years, yet it is still unknown and on the best way to diagnose and treat this disease. So the symptoms of achondroplasia dwarfism are a prominent forehead, which is caused by the abnormal growth in the skull, delayed milestones. An example would be an infant or a toddler taking 18 to 24 months to start walking. Small vertebrae canals, a curved lower spine, which is a result from the abnormal growth of the spine, misaligned teeth, flat feet that are short and broad, frequent middle ear infections, and poor muscle tone and loose joints. So the causative factors of achondroplasia dwarfism. So the main cause is a mutation in the fibroblast growth factor receptor 3. The function of the fibroblast growth factor receptor 3 is it provides instructions for making a protein that is involved in the development and maintenance of the bone and brain tissue. Two specific mutations in the fibroblast growth factor receptor 3 are responsible for almost all cases of achondroplasia. Researchers believe that these mutations cause the fibroblast growth factor receptor 3 protein to be overly active, which in turn interferes with skeletal growth and leads to the disturbances in bone growth seen with this disorder. And percentage of causation. 80% of patients affected by achondroplasia dwarfism, it's caused by the mutation in the fibroblast growth factor receptor 3. 20% of patients affected is caused by inheritance from a patient. So this is due to it may be inherited as an autosomal dominant trait, which means that if a child gets the defective gene from one parent, the child will have the disorder. If one parent has achondroplasia, the infant has a 50% chance of inheriting the disease. So how many individuals are affected by achondroplasia? It is estimated that 1 out of every 40,000 births result in achondroplasia dwarfism. However, 1 in 5 cases are a result from inheritance from a parent. And the current estimate of the global population is that achondroplasia dwarfism affects 250,000 individuals worldwide.
How is achondroplasia diagnosed? Achondroplasia can be diagnosed before birth and also can be diagnosed after birth. One way achondroplasia can be diagnosed before birth is fetal ultrasounds. Fetal ultrasounds use sound waves in a computer to see a baby in the womb as it is growing. The image on this slide demonstrates what a fetal ultrasound looks like. You can see the depressed nasal bridge and the prominent forehead, which are both symptoms of achondroplasia. Another way of before birth diagnosis is DNA testing. DNA testings help confirm fetal ultrasounds. One after birth diagnosis is physical examination. Physical examination can be just looking at certain things and symptoms that could lead to achondroplasia. Another thing would just to be looking at their complete medical history. For this slide, I used Johns Hopkins Medicine to gather information. Is achondroplasia preventable, and is achondroplasia treatable? Right now, there are no ways to prevent achondroplasia. Researchers are looking further into the subject but have not found an answer. For the most part, it has been said that through genetics, achondroplasia will happen. Most of the time, if the parents have it, the children will have it, and doctors do let parents know this outcome. Is achondroplasia treatable? Not really. There are no real treatments for achondroplasia. However, they can relieve problems caused by the conditions through different things, such as treat hunchbacks, fixing dental problems, and just testing for bone problems. For our study tool, we decided to use a Kahoot. So I'm going to go ahead and switch over to that right now. And as I'm switching over to it, this Kahoot will basically just help summarize everything that we went over and give you a better understanding on achondroplasia. What is a symptom of achondroplasia? Poor eyesight, prominent forehead, insomnia, or small feet? The correct answer is going to be prominent forehead. This was said in one of our earlier slides when we talked about symptoms. What percentage of people affected by achondroplasia is through inheritance from a parent? 20%, 25%, 40%, or 10%? The answer is going to be 20%. More males are affected by achondroplasia than females. Is this true or false? The answer is going to be false because, like we said earlier, females are more affected by achondroplasia. How can achondroplasia be diagnosed? Fetal ultrasound, X-ray, blood sample, blood pressure. Fetal ultrasound is going to be the right answer for this one. Like I said, that's actually one of the most common ways before birth to diagnose achondroplasia. What is achondroplasia? Critical enzymes are missing, the inability to ossify cartilage into bone, decreased production of one or more hormones of the pituitary gland, abnormalities in either chromosomes 7 or 11. The answer is going to be the inability to ossify cartilage into bone. Achondroplasia affects 1 to 40,000, 1 to 35,000, 1 to 30,000, or 1 to 45,000. The answer is going to be 1 to 40,000. True or false? Achondroplasia is not preventable. This is definitely going to be true because there are no real ways to prevent achondroplasia at the moment. What causes achondroplasia? Excess of osteoclast, deficiency of chondroblast, deficiency of osteoblast, mutation in the fibroblast growth factor receptor 3. The answer is going to be mutation in fibroblast growth factor receptor 3. These are the sources that we used throughout our presentation, and we hope that you have a better understanding of achondroplasia.